Hey, I'm David Mullinax, and I'm going to be demonstrating how to do a emergency situation for a fracture. So I did get prior permission to use this stuffed mannequin here, and it is pretty good for demonstrations like this. He stands up really well, and he's got a lot of stiffness really to the joint. So. All right, so let's say that this patient has a fracture in the front left leg, and it's very obvious, and we're just going to run through what we would do in that situation. First and foremost, safety is of utmost concern. So the first thing we're going to do is we're going to get Taylor's going to help me restrain here. We're just going to get a muzzle, an appropriate size muzzle on. We're going to protect his head, making sure that we don't get bit, making sure he doesn't hurt himself, he or she, whatever the patient may be. I'm just going to put this on, and Taylor's got him properly restrained here. And after I get this on, we're going to use a makeshift stretcher to get him onto the table so we can assess the situation a little bit better. So I'm just going to tighten that. Okay, and Taylor's got him restrained. We're going to use this towel, like a stretcher, and I'm just going to place it in front of the patient, and then we can use the corners to use it like a stretcher and get him onto the table. So we'll lift on 3, and 1, 2, 3. Okay, and then we're going to use the corners of the table to lift up and get him up there. And then we'll move the camera as well. Alright, so without having to move the camera, Taylor would have immediately got into the proper restraint here. And she's just going to hold the leg so that he can't get up. And like I said, we do have a fracture, so we're going to do a modified Robert Jones with a splint, an emergency one though, so we're going to do it pretty quickly. And we're just going to get the splint on right here, and we're going to take some cast padding and secure it like this. I'm still going to leave the toes exposed, and I am also going to wrap distal to proximal. I'm just going to go all the way up here. And now we've got this patient in an area where he's not going to do any more damage to himself, and we've got him to a point where he can't hurt us either. So in this situation, this is exactly how you would want to handle it, and I'll continue this video additionally by doing, we'll move on to bleeding, and we'll go on from there. Hey, I'm David Mullinax, and I'm going to be demonstrating how to do basic first aid simulation for a bleed. I did get prior permission to use this stuffed husky here, and if we are dealing with a bleed, we always want to have gloves on, just in case, as a precautionary measure. We don't know where the blood's coming from. It could be from the patient, it could be from the owner. You really just want to be safe. And continuing with the theme of safety, the first thing you always want to do is stabilize the head and immediately get a muzzle on. And you want to do this gently to where you limit any kind of danger as far as getting bit. So we're going to say that this patient has a bleed from the front right leg, and I'm going to kind of walk you through a few things that you want to do initially on right when they arrive, or really in day-to-day life if you come across this. So if we're bleeding from the front right, the first thing you can do is apply pressure with some gauze if you have some on hand, and you can check every 3 minutes or so to make sure, to see if we're still bleeding or if we've achieved hemostasis, if the bleed has stopped, and then we'll kind of work our way up from there. If it's still bleeding, you can actually go ahead and get some vet wrap and create a pressure bandage. And I'm just doing that by leaving the gauze where it's at and I'm just putting vet wrap over it to kind of hold it in and keep it in place and keep it on there. So if we're still bleeding through the bandage, it's still just perpetually bleeding, we have tourniquets on hand that we can use, and it's going to constrict the leg here. I'm going to put it at a proximal portion of the leg, and it's going to limit the blood supply to this limb here, which is going to help with the bleeding, but we also have to be cautious that we're not going to compromise the leg. So every let's see, 15 to 20 minutes or so, we're going to loosen up for just a bit, about 20 seconds, and then we're going to place it back so that we do get some blood flow, but we're restricting it enough to where hopefully we can stop the bleed. By this time, we will have a veterinarian come into the room and further instruct us on what to do. So I'm going to go ahead and take this off, but that is a basic first aid simulation of a bleeding patient. Hi, I'm David Molinax. I'm going to be demonstrating how to do basic first aid on a choking patient. I have gotten prior permission to use this mannequin here for these demonstrations. So if this patient is coming in or just starts choking while it's with us, the first thing I'm going to do is I'm going to open the mouth and I'm going to see what the gums look like, and if they are blue, and we'll say in this case that they are cyanotic, that means the animal's not getting enough oxygen, and it furthers the idea that the animal is choking. The next thing I'm going to do, being careful not to get bit, is I'm going to look down the airway and see if there's any obvious obstruction. If so, I'll be able to scoop that out, but just being sure to be safe for both me and the patient. If that doesn't work, if I don't see anything, or if I'm unable to get it, I'm going to move to the Heimlich maneuver. And in a canine, it's similar to with humans. You're going to come to the end of the thoracic spine here, the end of the ribs, and you're just going to place both hands underneath the patient like this, and you're going to apply enough pressure that we're creating a large gust of wind, and we're just going to continue to do that until hopefully the patient gets that whatever they're choking on out of their system. You can even do it to the point to where you're kind of lifting the patient up. So if that still hasn't worked, we're going to lay the patient on the side, and we're going to use, in the same area, our palm to kind of hit at this area and continue to create that gust of wind. So the hope here is that we wouldn't get to that point to where it's choking to that extent, but if it is, the veterinarian would have been contacted in some way by another coworker, and either giving instruction over the phone or in person in the room, and we'll continue to, attempt to reverse this problem. So that's how you do basic first aid for a choking patient. Hi, I'm David Molinax. I'm going to be demonstrating how to perform basic first aid on a patient presented with heat stroke. I did get prior permission to use this animal here for this demonstration. So we've already taken this patient's temperature. It was, we'll say, a 105, which it correlates directly with a heat stroke. So the first thing we're going to do is we're going to artificially cool the patient using wet towels, using cold water. And we can place those on the patient's head and neck. And with a heat stroke, you continuously want to take the temperature, especially if this goes over a long period of time. That being said, if it was a long period of time, or even if we have a wet table available, that is the ideal space for this, because along with the wet towels and the artificial cooling, we can also run water across the abdomen and the feet as well. We're going to continuously re-wet the towels, and we're also going to continue to check the temperature. Hopefully by the time we've got all that situated, a doctor at least knows the situation, is maybe on the phone with somebody, or is in the room providing further instruction. At that point, the doctor may want to get an IV catheter in, so we can start doing some cool fluids, or really any direction they want to go from there, we'll just be there to assist. and that's how you perform basic first aid of a heat stroke. Hi, I'm David Molinax. I'm going to be demonstrating how to perform basic first aid if a patient is presented in shock. So I did get permission to use this for these videos. I just wanted to mention that. But the first thing you want to do with the patient is you want to kind of check their capillary refill time by digitally pressing on their gums. And that's going to give us an idea of their perfusion rate, like how fast their body is getting the blood to come back to the area where we kind of spread it out. And if the patient is in shock, you're going to see that that is most of the time greater than 3 or equal to. And along with that, you can also check a femoral pulse, which is going to give you an idea of their blood pressure, whether it's absent, weak, or fully present. You can gauge kind of how far or how high or low their blood pressure is, along with their dorsal metatarsal arterial pulse. You can kind of gauge that. So after you've checked both of those, the capillary refill time as well as the femoral arterial pulse, you can oscillate the heart. At the same time that you're doing that, you can feel for the femoral pulse to see if there is any sort of deficit where they're kind of firing at different ends. So I'm going to go ahead and do that. While I do that, I'm going to pay attention to the clock so I get a respiration rate along with the heart rate. And I'm going to listen to both sides of the heart. The whole time I'm going to keep my hand back here on the medial portion of this back leg. And I'm going to see if there's any sort of deficit. I'm just going to do that. Okay, and as you can see, I've got my my right hand back here, so for that femoral arterial pulse. Okay, I'm just going to be sure to get a heart rate as well. And a respiration rate. Now in this case I am feeling a pulse deficit. So after doing that at this time, most likely a doctor will be here to kind of take the lead, and we technicians can kind of assist in any way that may be, whether it's putting a catheter in or just anything the doctor may want us to go ahead and start doing or prepping. We can do that with his guidance. When a patient is in shock, you want to continuously check their temperature as well, because that can kind of give an indication whether the patient is compensating or decompensating. If the patient does go unconscious, however, they're most likely, or they will be laying down, but you want to keep them as level as possible. You don't want their head off the table. The doctor can come in at that point and guide the technicians on what to do. And that is how you perform basic first aid of a patient in shock. Technician's desk, this is David. Hey. Okay. So we ate chocolate, is that what you said? Okay, yes ma'am. Alright, well, do we know what kind of chocolate? Do you still have the wrapper? Okay, you do? Okay, perfect. Okay, if you could just go take a look and see exactly what kind of chocolate was eaten, and if you could get an idea of how much too, that would be helpful as well. And I'll be right here for you, okay? Okay, so you do have it. Alright, well, let's see, can I get your name, please? Are you a current client of ours? Okay, we have seen you before? Yes, ma'am. Okay, well, give me a second to kind of look in to your file and, okay, so, okay, Miss Stevens, okay, I've got you right here, and this was Samson? Okay, yes, ma'am. Alright, well, give me just a second, since I've got the weight and all of the information here. I'm gonna get with the doctor that's working today and kind of see where he wants to take this. I do recommend though that we would like to see you today, but just let me put you on hold for just a second, talk to the doctor, and we'll see what we want to do about this beforehand. Okay. Okay, so in that case, it was a current client of ours, so I did have all the information at hand. Um, so I was able to pull that up, and I can relay that to the doctor and just let them know what kind of chocolate um, and the weight of the dog, and kind of see what the veterinarian would want to do in that situation. If it was a small dog, like say a 5 pound dog, we can try to induce vomiting in the dog if it's the vet's decision to do that, and we would just do approximately 2 milliliters per kilogram, and we would just stay on the phone until the animal does vomit. Um, so in that situation, I would go talk to the vet. I would come back, and I would just kind of inform the client on what to do, walk her through the process, and kind of just be with her throughout it. At the very end, no matter the situation, we'd still want to see the animal on that day. Whether it vomits or not is still something that we would like to see the animal for. Now, if it was something more serious, say we ate some sort of, or we just got under the counter, the client doesn't know exactly what kind of chemical that the dog or cat or whatever animal may have you got into, then that's something that we would still want to see the animal on that day, but we would immediately give them the poison control number, which I do have on hand. Is in front of all of our computers, just for situations like that. The main thing here, though, is to, gather the information on exactly what we ate, gather the information on everything about the animal as far as age, weight, size, breed. All of that's very important. How long ago we ate it, how much we ate or drank, and we can kind of go from there and give the veterinarian a lot of information, and we can handle that accordingly. Now, when we do ask them to come in, we would, if they do have a container, we would ask them to bring whatever the animal did eat so we can see it for ourselves. So any kind of poison, immediately we would still want to see them, but we're going to get them into poison control, because they're the ones who deal with this every single day, and they're going to have quicker information for that client. If it wasn't a client at all, we would need to ask these questions, because it's not at our fingertips in our our medical history, but that is how you would handle a poisoned or a poisoning or an exposure to some sort of toxin over the phone. You just kind of handle it as quickly and professionally as possible, giving the most support you can, letting them know exactly what's going on, getting them in touch with the right people, as well as relaying the information to a veterinarian so you can make that call. Now, if the vet does deem it necessary to make the animal vomit, that's his call. It's not something we can just tell the client to do on our own. But anyway, that was a little demonstration on how you would handle anybody calling and their dog's gotten into some sort of toxin or even some sort of poison.
Hey, I'm David Mullinex, and I'm going to be demonstrating how to provide basic first aid for a seizing patient. So if a patient is seizing, they're really out of it, and they're just shaking, convulsing, they may be paddling. And the idea here is that we want to get them in a tranquil environment. We want to have them on a padded surface as to not hurt themselves. We don't want any sharp objects around. The less objects that are around, period, the better. So along with that, creating this environment that's less stimulus to the patient, everyone who's around the dog or the cat or whatever animal it may be needs to be using a whispered voice. And we can also turn the lights down low, just really get it calm. and kind of minimize any type of external stimulus possible. So we have them on a padded surface here. I have a pad underneath and a towel. If it is safe to do this, you can actually get their head a little bit elevated with another padded, I'm using a towel here, which is perfect. So when the patient is seizing, it's very important to time the seizure so that we can determine what kind of seizures this patient is actually having, and if they are actually having seizures at all. So with that, just time the seizure. It's always important to make note of when you see the patient seizing and see how long it actually takes. So at that point, you don't want to do any restraint at all. You just want to get the animal. You want the animal to be in a place where it's not going to injure itself or anyone else. But you don't want to restrain. You just want to really create this calming environment, and you want to keep up with the timing of the seizure. At that point, by the time the seizure is going, before the seizure stops, most likely the doctor is going to be informed about it, and they can take action as far as getting anti-seizure medication ready, or whatever they may want to do. They might want to, once the seizure stops, immediately get an IV catheter in, start IV fluids, really anything that they deem necessary for treatment. We can kind of do that at a quick pace for the doctor. So that's basic first aid for a seizing patient. And that's it.